Myocardial infarction, generally known as heart attack, is a condition that occurs when one or more areas of the heart muscle don't get enough oxygen. In event where it is even more serious, it is known as acute myocardial infarction or AMI. This condition is caused by the buildup of plaques in coronary arteries, known as atherosclerosis. Coronary arteries become narrow and blocked with plaques made up of cholesterol and fat deposits, resulting in blood clots which inhibit blood flow into the heart. So, what are the symptoms of MI? The symptoms of MI include sweating, abnormal heartbeat, nausea and vomiting, shortness of breath, and chest pain which travels from left arm to neck, tightness, squeezing, or burning sensation of the heart.
Biochemistry parameters is a laboratory test to estimate the concentration of circulation nutrients in body fluids. It is important to provide information about the functional status of major organ system. The question is how to diagnose the disease by using a blood test to detect a certain level of abnormal protein. So there are two common tests which are troponin T and I test and CKMB test. The reason why this test is selected because it fulfills the ideal cardiac marker which are sensitive enough to detect a small degree to the heart muscle, give information regarding the severity of the infection and the prognosis of the disease, show the result of reperfusion therapy in acute myocardial infarction, specific to the heart muscle, help in early and late diagnosis, and it very easy and fast to measure the protein level.
Serial testing of troponins is to measure the level of troponin T or I proteins in the blood. When the heart muscle has been damaged, such as during heart attack, these proteins are released. Troponin T and I levels in the blood will increase as the degree of cardiac injury increase. Appear within 3 to 12 hours after infarction. Peak value is at 24 hours. Disappears within 7 to 10 days. Sensitivity is 84% to 96%. Specificity is 80% to 95%. It is considered the gold standard to diagnose for acute myocardial infarction. Next is CKMB blood test. This test quantifies the level of the CK isoenzyme in the blood. It is known as CKMB because CK is found in many tissues. Having high level of CK can indicate a number of issues. A higher CKMB may more clearly indicate heart damage. This examination aids the medical professional in determining whether you are having a heart attack. Formerly a common method for identifying heart attacks, measuring CKMB is now less frequently used by medical professionals. Today, the test of choice for detecting a heart attack is cardiac troponin.
Cardiac cycle. The cardiac cycle is described as the alternating contraction and relaxation of the atria and ventricles to circulate blood throughout the body. Each cardiac cycle has a diastolic phase in which the heart chambers relax and fill with blood from the vein, and a systolic phase in which the heart chambers contract and pump blood to the periphery via the arteries.
Atrial and ventricular diastole. Both atria and ventricles are relaxed, and then blood flow from vena cava and pulmonary veins into right and left atria. It will increase the atrial pressure, and then blood flow from atria into right and left ventricles, which consists of 70% of blood. Atrial blood pressure, which is blood pressure in aorta and pulmonary arteries, is higher than blood pressure in ventricles. Due to high pressure in aorta and pulmonary arteries, it will close the semilunar valve to prevent backflow of blood into ventricles. The closing of semilunar valves will produce second sound do.
Ventricular diastole. Both the atrioventricular and semilunar valves close during the early phases of ventricular diastole. The volume of blood in the ventricle does not vary throughout this period, but the intraventricular pressure drops dramatically. When the ventricular pressure falls below the atrial pressure, the atrioventricular valves open. This causes the ventricle to fill with blood, a condition known as fast filling of ventricles. It accounts for the majority of the blood in the ventricle prior to contraction. From the vena cava, a tiny amount of blood rushes directly into the ventricles, and the remaining blood in the atria is pushed into the ventricle near the end of ventricular diastole. End diastolic volume or prelude refers to the entire volume of blood present in the ventricle at the end of diastole. Ventricular systole refers to the period during which the ventricle contracts. Shortly after the atria are depolarized, the electrical impulse arrives at the atrioventricular node. The AV node has a little delay which permits the atria to complete contracting before the ventricles are depolarized. The action potential travels to the AV node down the His bundle and then to the left and right bundle branches. These fibers conduct electrical impulse through their respective ventricular areas, causing contraction. As the ventricle begins to contract, its pressure surpasses of the corresponding atrium, causing the atrioventricular valves to close. When the ventricle pressure surpasses the outflow tract pressure, the semilunar valves open, allowing blood to exit the ventricle. End systolic volume between 40 to 50 ml of blood is the quantity of blood remaining in the ventricle at the end of systole. The stroke volume output is the amount of blood actually discharged from the ventricle. The ejection fraction is the ratio of stroke volume outflow to the end diastolic volume, and it is normally about 60%. The ventricles resume isovolumetric relaxation and the atria continue to fill. The process begins again and will continue indefinitely as long as the individual is alive.
This is an overview of pathophysiology myocardial infarction. First, when high level of LDL cholesterol and triglyceride in the body, it can deposition within the wall of the main artery. It can form a plug in the wall of the artery called atherosclerotic plug. Sometimes this plug may rupture. It can activate clotting mechanisms such as platelet aggregation and fibrin deposition, which lead to formation of an occlusive thrombus in a coronary artery. This thrombus completely blocks a coronary artery and interrupts blood supply to heart muscle. After that, it leads to ischemia. Ischemia develops when there is increased demand for oxygen or a decreased supply of oxygen. This in turn leads to tissue hypoxia. Hypoxia is a condition of the body in which the tissue are starved of oxygen. Hypoxia consists of several symptoms, for example, slow heart rate, shortness of breath, and sweating. Hypoxia can lead to angina. Angina is chest pain that happens because there is not enough blood going to part of your heart. It can feel like a heart attack with pressure or squeezing in your chest. Angina consists of stable angina, unstable angina, microvascular angina, and variant angina. In this situation, it only involves unstable angina. In this angina, you can have this while you are at rest or not very active. The pain can be strong and long-lasting, and it may come back again and again. Lastly, it causes necrosis. Necrosis is a condition of heart cell death and lead to myocardial infarction.
Myocardial infarction also occurs in persons who have atrial spasm. Atrial spasm, or also known as coronary artery spasm, is a temporary tightening of the muscles in the wall of one of the arteries that send blood to your heart. A spasm can decrease or completely block the blood flow to the part of the heart. If a spasm lasts long enough, you can have a chest pain, also known as angina. Unlike typical angina, which usually occurs with physical activity, coronary artery spasm often occurs at rest and typically between midnight and early morning. Other names for coronary artery spasm are Prinzmental's angina, vasospastic angina, or variant angina. It can cause necrosis and lead to myocardial infarction. Coronary artery spasm may be triggered by tobacco use, exposure to cold, extreme emotional stress, and use of illegal stimulant drugs such as amphetamines and cocaine.